All right. Um, just let me ask a little bit about, have you been following anything that's going on in Jamaica as it relates to COVID?
I have, and I was in Jamaica on vacation in March. March, I think we were there for a week
Mhm.
before everything.
Exploded.
Yeah. When we were in Jamaica, surprisingly, we came from New York.
Mhm.
Actually, we flew out of Newark in New Jersey, and when we got to Jamaica, I have to say there was over 300 or more
Mhm.
people waiting in line to be cleared through immigration and customs. I did not see any sense or type of social distancing being practiced. I did not see anyone being screened. My family and I, we weren't screened. Um, we went up to the immigration officer and we presented our documents, and then we went straight out. And coming back was the same thing. We weren't screened. We weren't asked. And when I say screen, I want to be clear. We weren't asked any questions related to COVID-19. Um, I didn't see any medical professionals at the airport
Mhm.
in arrivals. I don't know now if that's, well, I don't know if their borders are closed or what the
Close.
situation. Okay, but at the time when I traveled, there was nothing. And when during the week of us being there, I think the first case of COVID-19 was announced.
Mhm.
And apparently that person had traveled in or landed a week prior or during a couple of days before us.
Mhm.
Um, I think the situation in Jamaica is there. Well, first of all, I have to say that with the numbers in slowly climbing, I'm a bit concerned, and I'm very worried. Not a bit. I am very worried. I do not, and this is not to put down the healthcare sector of Jamaica or the Ministry of Health. I personally believe that Jamaica is not equipped to deal with such an outbreak.
I agree.
I have a sister who's a registered nurse, and she works in a hospital in Jamaica. And I talk to her about this every day. I follow the news. Jamaica is a very small island. Um, and I just worry a lot about.
What's the numbers like now down there? Because I believe I heard um, 7 deaths so far.
So last night, I think it's Jam COVID-19, the website. I looked at that and it was I think it was 386 around
Ca-
that
Cases.
cases, and their recovery rate is a lot. Um, and the death toll, like you said, was only 7.
Mhm.
I think, however, those numbers are going to increase as soon as more testing is being conducted. Um, I I feel as though that a lot of persons, and for instance, I had a friend here who was exhibiting COVID-19 symptoms,
Mhm.
and throughout he contacted me at the end of the symptoms and what should he do, and I advised him of somewhere where he can get tested, and thankfully the doctor tested him,
Mhm.
but the test came back negative. And when he went back to get his results, he was told that it's a possibility that he had the symptoms. But of course, if you had this, it's a possibility rather that he had the virus. But of course, because now the the symptoms are past, or it probably had passed the stage of infection, it won't show up on the test. And I feel like should this be the case with Jamaica, with these persons who are tested negative,
Mhm.
but may have been in contact with persons who are susceptible to the virus, like persons who have a weaker immune system or someone who is elderly with underlying comorbidities.
Mhm.
I just worry that it's gonna be an outbreak.
Let's hope not. But I guess the information that's going around Jamaica, or people in Jamaica, they just need to try and follow what the global health organization is saying, right? And it's been echoed by the Ministry of Health in Jamaica. Practice social distancing, wash your hands whenever you leave your house and going back. You wash your hands, wear your masks, right? Like you said before, if they observe someone that might be exhibiting some of the symptoms, exercise some form of
Right.
caution. You know.
But I feel like what I understood is the outbreak, because Jamaica had, prior to this call center, there was a call center. Their numbers was very low.
Yeah.
And I think now, when I read online, it's saying 220 cases from the 386 is from the call center.
Yeah.
So
I heard that too.
and these are the things like, I don't know, because I've never been to a call center and I've never worked at a call center. My question when I hear that is, I got angry because, for one, these person, because the prime minister, he had put St. Catherine on a lockdown because that's, I don't know much, but is that where the call center is, in St. Catherine?
Yes, the call center, I believe, is in Portmore.
Okay, so this is my logic of not seeing the sense in that. I live in New Jersey. I work in New York, right?
Yeah.
So if I work in St. Catherine, it
Mhm.
doesn't mean that I live in St. Catherine.
Right.
So these persons who work at the call center, I'm pretty sure they live in surrounding communities, or other parishes, and probably commute into St. Catherine for work.
Right.
So locking down that specific area, these persons have already exposed other people, taxi drivers, their families, shopkeepers, and
Yeah.
I don't know.
There's actually a news article, Jamaican news article, broadcast actually. I think one of those stations on there, and they were showing people fleeing Portmore by the hundreds, blocking the highways and all that stuff. And I'm like, those people are going to different parishes. Literally, they're going to different parishes from these locations that they're trying to close down. So it's yeah, Jamaica has a lot to
I
consider.
feel like, this is not just Jamaica.
True.
I feel that a lot of humans feel like we're invincible.
Yeah.
I feel like this population is the younger population, where we're youthful, we're strong, and we're invincible. And I just want to put this fact out there, that a lot of the cases that I've seen in the hospitals, I've had patients who are my age, patients who are older, patients who are younger than me. And one thing that I can conclude is COVID-19 is the great equalizer. It does not care how young you are, how beautiful, how rich, how old. All it wants is an oath.